With a herniated disc and sciatica, the one thing I would do before spinal surgery is this. I helped fix my back 5 years ago with non-surgical spinal decompression. I had an L5-S1 disc herniation. It was on the nerve, severe lower back pain and leg pain. I didn't want to have surgery, and I fixed it with spinal decompression. Now I help thousands of patients. But I'm still up against the wall against these questions. So I want to show this article. This article was from 2022. It's based out of Korea. And not only did they show that spinal decompression was effective at reducing lower back pain for people with disc herniations in the lower back, it also showed that there is a method called the Herniated Disc Index on measuring the size or the amount of reduction of the disc herniation. And you may be thinking, well, this is new, this is 2022, like this has never been done before. It's not proven. How they measure this, okay, you take measurements of the spinal canal on both sides, so depth and width, and then you take measurements of the width and the depth of the disc herniation. So you kind of get a puddle, and it's a relative size of that puddle to the actual space of the canal. The canal is where your spinal cord is. So you want to see how much of the disc material is occupying the spinal canal. This study shows that spinal decompression reduces the size of the index or the puddle relative to the overall size of the canal. It shows that it works. Hey, but this is a new thing. This hasn't been proven. There's no scientific research for it. How about this? Hi, it's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve. Back to the show. This is a study in 2018, 6 years ago. It compares spinal decompression to traction. One of the many topics I discussed, actually one of my podcast episodes where we compare the two, it shows that spinal decompression is more effective than spinal traction when it comes to reducing the size of the disc herniation. How does it measure the size of the disc herniation? It does that with the Herniated Disc Index, HDI, the same one from the Korean study. So yeah, this has been around not only for 6 years, it's been around for decades. And it's how we measure the actual herniated disc so we can see if it reabsorbs, if we're actually helping solve the problem. Okay, well, these are two papers. Your method doesn't work. Okay, let's check out Jeff. Here is a pre and post MRI using the Herniated Disc Index to show a 45% reduction of the size of the disc material. So if we measure the width and the depth and we get a number and we correlate that number with an equation to the overall width and depth of the canal. How much is occupying the canal? 4 months after, so this patient had severe lower back, he couldn't walk, okay? He couldn't walk. His pain was so far into his butt, into his calf, he couldn't walk. 4 months later, he's completely pain-free. He's exercising again, he's swimming, he's at his kid's soccer game and basketball game, he's doing everything and he's pain-free. Okay, well, it's a temporary fix. Now, check out the post-MRI with a evaluation of a pre and post herniated disc index, same as the Korean study in 2022, same as the study in 2018, 45% reduction in the size of the disc herniation via the Herniated Disc Index. Live better lives without drugs, medications, and surgeries, and I'll keep making sure that we're fixing the problem. with a pre and post MRI and evaluating it with a herniated disc index that's been used for decades to measure disc herniations. Hey, if you like this material, don't forget to subscribe to the channel where I'll show you other effective ways to help lower back pain and also reduce the size of your disc herniation that's proven with a disc herniation on a pre and post MRI. I'm Dr. Dudum. Thanks for watching.